Hi everyone, welcome to this evening's session. Do pop a comment in the comments box, say hi, let us know if you're watching live and where you're watching from. My name's Zoe Clark, I'm Senior Self-Management Programme Officer here at NASS, and tonight I'm joined by Geoff Lindsay from Yoga for AS. Hi Geoff, how are you?
I'm fine, thanks Zoe. Thanks for having me along.
Absolutely, thanks for joining us. You're a familiar face, so hopefully lots of our viewers have seen either your sessions or Jamie's sessions in the past and are joining us for a bit more. So for everyone watching, Geoff's going to be leading us through a yoga session today, focusing on the hips and the sacroiliac joints, so the SI joints. So I'll hand over to Geoff shortly, but don't worry because the session is recorded. So if you want to sit back and watch and then check with your healthcare professional if it's suitable for you, you're welcome to do that and watch it on catch up. So before we get started, Geoff, do you want to tell us a little bit about yourself?
Hello everybody, yeah, I'm Geoff and I have AS, have had my first symptoms in 1973, diagnosed in 2009. My sacroiliac joints are completely fused and I have a little fusion in my neck in 3 vertebrae there. But otherwise, I lead an active life. I'm co-founder of Yoga for AS along with Jamie Boda. Yoga for AS is an online community of people with AS, and we have a library of 20 courses which you can access and 4 live classes a week which are recorded and you can access those as well. The website where you can access and check out all of that is yogaforas.com. So what we're going to do today is some very simple and easy yoga for your sacroiliac joints and your hips. I'll just start off by showing you where the sacroiliac joints are, because for many years I didn't have a clue. I had no idea that the back pain I was getting was coming from inflammation in the sacroiliac joints. And where the spine joins the pelvis down here, there's a line on either side here, and that's the sacroiliac joints where the spine joins the pelvis, and it's a strength joint. It's designed not to move very much. And so if we get inflammation there, then that's very difficult to get rid of. But we're going to make a start today by doing some breathing and come to sitting on a comfortable chair like this one. So this is my yoga chair. It's flat here and the length of the legs suits the length of my shins. So I can sit here and sit quite straight. If your feet don't comfortably touch the ground, you can put a cushion or a block underneath your feet. And if it helps, you can put a cushion in the back here so that you can relax and lean in, put that into there. The idea of yoga for AS basically is that when we're in chronic pain over many years, that we slump into what's called the question mark pose. And it's kind of counterintuitive, but you really want to try sideways just to demonstrate to you how we're going to try some breathing. And this is breathing with the whole of the diaphragm, the whole of the chest. So take your right hand and put that over your belly button there, and your left hand on your chest, and just look down for a moment. And when you breathe in, you want to see the right hand rise out first. And that means that you're breathing from the whole of your diaphragm, not just from your chest. So I'll demonstrate. Breathing up into the chest and then a nice long exhalation. And the reason we start with some breathing is to stimulate the relaxation response. And when we relax, we stretch a little better. So, together, in your chair, with a cushion or without, with a cushion under your feet, get yourself nice and comfortable. Right hand on the tummy, left hand on the chest, look down, Breathe in. And look straight ahead as you exhale. And try and do a long exhalation, maybe to the count of 4. Depends on your lung capacity, you may get to 5 or 6. Breathe in again. And relax the shoulders down. Try not to hunch the shoulders. And then carry on in that cycle for 3 to 5 more inhalations and exhalations, just practicing that breathing from the belly, so the belly goes out fast. And you can take your hands away from your stomach and your chest and rest them on the tops of your thighs, gazing straight ahead. Keep relaxing the shoulder blades inwards and downwards, increasing the gap between the tops of your shoulders here and the bottoms of your earlobes here. And just be comfortable. Maximum comfort is always our intention in Yoga for AS. We don't do the Yoga Olympics, so just breathe nicely, softly, gently. And now, after your next exhalation, very slowly come to standing. Take your cushion away. Push your chair to one side. Now, I'll just demonstrate again what we mean about the question mark pose. When we're in pain, and also because AS shortens and hardens a lot of the ligaments and tendons, we tend to slump into this position. And what yoga is trying to do is to lift us out of it so we've got a better posture and we avoid a hunchback and that kind of thing. So simple pose is called a mountain pose, and I'll demonstrate this from the side. But first of all, stand with your feet hip width apart and the feet are parallel. So you can see from the side, from here, just try to come out of this and stand as tall and straight as you can comfortably. Don't strain. We say stretch, not strain. Lift up from the arches of the feet. Lift up in the front of the thighs. Lift up in the front of the pubic bone there and tuck the tailbone down at the back. This is the pelvic tilt. So we're lifting up in the front, down in the back. And feel the lift here, just in the underside of the shoulder blades here. Lifting the chest, gazing straight forward, crown of the head rising to the ceiling. Just roll the shoulders out slightly so the palms are facing very slightly forwards, and breathe. Keep breathing, breathe, breathe, breathe. Move on the out breath. So just keep trying to get that lift, relaxing the shoulder blades down again. Think about your shoulder blades and then just release them again, let them go. Lift up, keep the lift in the front of the tummy. This is the mountain pose. We're standing as tall as a mountain. Crown of the head rising to the ceiling. So there we are. And now, with your chair in the same position, find the heel of the hand. The heel of the hand is just here, so it's not the palm or the wrist. And place the heels of the hand on the top of the chair at the back there, and this is the standing tabletop. So find your distance. Now, this may be as much as you can do, and that's fine. You may be able to straighten a little more, and that's fine too. But the one thing we don't want you to do is to overstretch and try to achieve some perfect pose. In yoga for AS, we don't really believe in the perfect pose. So just get the heels of the hands on the chair, have a soft bend in the knees here, and stretch the spine out. So we're trying here to lengthen the spine. If you can, get the ears between the upper arms, the insides of the upper arms, that's good. But try not to let the head go down too much, or avoid arching the back of the neck as well. Keep breathing softly and gently. I'm going to adjust my feet. As we stay in a pose, sometimes we can relax more into it. If your spine is rounded, but you're doing this, that's good. Don't worry about it being rounded. And keep breathing softly and gently. Open up underneath the armpits and extend the fingers away. The fingers are positive, pointing away from you. We're feeling that opening on the outside of the vertebrae in the lower spine. And then come out of the pose very slowly by stepping forwards and lifting the head. Now, there are two options now, and the choices in Yoga for AS are real. We really want you to become an expert by experience, to learn what you can do without feeling horrible afterwards, and what's good for you and helps you to feel loose afterwards. So we talk about yoga poses that you can lighten to make easier or to intensify. So you can, if you wish, repeat this one, just with the heel of the hand to the chair, soften the knees. But what we're going to do now is just breathe in, and on the out breath, take the right hip back a little and feel the stretch here on the top of the right side sacroiliac joint, just there. So we're just giving a bit of a stretch there. A lot of the pain that we get from the sacroiliac joints is also from the entheses, which is where the ligaments and tendons and muscles join onto the bones, as well as inside the joints. So just repeat that again on the out breath. Take the right hip back, just very gently, don't overdo it, and feel the stretch right the way from your right hand, right the way down through the right armpit, the right side of the ribs, down to the right hip. And then release, come back to center. And we always do both sides. So breathing in, on the out breath, take the left hip back and stretch from the left fingertips down through the left armpit, the left side ribs, to the left hip, and stretch that back. And keep breathing while you're doing that. Move on the out breath as much as you can. So from here to come out of the pose, very slowly, walk forwards and come to standing again. So there we are. We've had the mountain pose, the standing tabletop. We've had some choices. Now, one that's really one of my favorites for relieving that sacroiliac pain, that pain that you get here, that radiates down through the buttocks, down through the hips. For years, I thought this was a pain in my hips. So again, take the heels to the top of the chair back and have your feet hip width apart as you did before. Now put the right foot forwards and the left foot back. And just start to, you can micro adjust here. Like so. So have the arms as straight as you comfortably can. And this right leg is forwards and slightly bent at the knee. And the left foot is also is pointing out slightly to the left. So if you were to stand up now, these points of the pelvis are pointing to the left. The idea is that we just turn the pelvis so that these points of the pelvis here are level with the hands. And you can stay here if you wish. If that's enough for you, in the language of yoga, this is called Parsvottanasana, my favourite. If you want, you can extend forwards. And just again, take the right hip back. And then we're getting an opening here throughout the right sacroiliac and in the right joint. We're mobilizing the right hip joint. Then step forwards. Take the left foot to the same position as the right, but a few inches apart. Take the right foot back and point the right toes out. Now you can see that these points of the pelvis are pointing to the right of the chair. So breathing in, you turn, you can move the foot. You want to feel that this is a good stretch, that it's not a strain. So only go as far as you're comfortable. And in fact, if you go to your maximum, then just ease off a little. And then if that feels good, on the in-breath, take the hands up, stretch out to the back of the chair, soft bend in the left knee, and reach back, taking the left hip back there. Trying to keep the pelvis level to the floor. Breathing softly and gently. And then step forwards and come to standing. And you can shake out as well. Now, our next pose is simply sitting on a chair and crossing our legs. Now, there's a particular way of doing that. So we're sitting again about halfway back on the chair and sitting tall and comfortably. You can again, if you wish, put a cushion into the back of the chair, just if that helps you. We use props a lot to help. If I'm putting a cushion or a yoga block in my spine and I'm sitting to the table, that can really help. So you can transfer the yoga phrase to your daily life as well. So from here, sitting with knees no more than hip width apart, so not splayed out, and feet not splayed out, feet are pointing straight forwards. Breathe in and just lift the right knee and cross your knees like so. And try to sit nice and straight. If you can reach your left foot with your left hand, take hold and take the right hand to the outside of the right knee. But if that's too much of a stretch for you, just take the hands to the legs there. Sit up straight. Breathing in, on the out breath, bend very, very slightly forwards from the hips, not the waist. Keep the spine straight and the head in line with the spine. Now, I'm not pulling the leg towards me, but I can feel a stretch starting in the right hip. And if I move the movement from the right knee to the right shoulder to the right knee to the left shoulder, that moves the stretch very slightly into the outside of the right sacroiliac joint. So we're just easing out any inflammation that's in the enthyses there on the outside of the right sacroiliac joint. But do be gentle here, that you're not rocking yourself about and you're breathing into the pose. And then release. Get yourself comfortable again with the pose so that you can sit comfortably here against the chair back with the cushion. And then lift the left knee and cross the knees there. Sit up tall, just a little bit away from your cushion. Again, if you can take hold of the right foot with the right hand and the left hand to the outside of the left knee, and remember, you're not pulling against anything, you're holding as much as anything. And the movement comes from the lift of the chest and a very slight movement forwards, bending forwards from the hips. It's a very, very small movement until you feel that stretch in the sacroiliac area. If you're in an SI flare, you might not want to do this pose. You might certainly want to ease off a lot. This is an asymmetric pose. You want to be, if you're in flare, taking a great deal of care because you can make things worse very easily, as I know. So keep breathing. And now take both hands to the outside of the left knee. Very gently change the movement so that the left knee is moving across the body towards the right shoulder. Breathe and relax into that. These are very, very small movements. We're not trying to force anything. And then release and let go. And now we're going to come to seated savasana, the relaxation. And this is often done lying on the floor. But this is a taster for some people who may only be looking at yoga for their AS for the first time. So have your chair on a non-slip surface, quite close to the wall, so that when you lean back, your head can touch the wall. And have your cushion for the comfort of your spine. Something warm to put on because you'll lose some warmth when you're sitting still, especially on these cold evenings. First of all, comfort. There, now I can lean back quite comfortably. If you have a cushion under the feet, it stops the feet from sliding away. Breathing in, just allow the shoulders to rotate slightly, the hands to hang by the side, and gaze straight ahead. And you can remain in this position. You may wish to close your eyes. We'll only be here for a minute or two. But the idea is that by relaxing, we are able to remember everything that we've done. Maximum comfort is always our intention in yoga for AS. Allow yourself to relax in your jaw. Consciously relax the jaw. Feel the gap opening between the top and the bottom teeth. The tongue relaxes back, the eyes soften and look down. Try to avoid arching the back of the neck. And allow the relaxation from your jaw to spread to your forehead. And release and let go in your forehead. Release in your scalp. And then allow waves of relaxation to travel down your spine as you relax against the chair and the wall. The arms become longer and softer and heavier. And allow the waves of relaxation to keep open those spaces that we've just opened up in your hips, the sacroiliac area. And allow your breathing to bring life to those areas of inflammation from which we suffer in AS. And then allow the relaxation to carry on down through your legs to your feet and relax your feet as well. Here, now, Savasana, a minute of peace. Keep breathing softly and gently. And now, when you're ready, no rush, no hurry. Come to sitting up in your chair. Come to a comfortable sitting position. And then usually at the end of a yoga class, we greet each other by bringing the hands together, just saying Namaste. Namaste. So there we are. A little taster of yoga modified for AS. Thinking mostly about how we can use yoga to get into the sacroiliac joints, the SI joints, and the hips. The lifetime prevalence, I'm told, for sacroiliac pain is 100%. In other words, all of us get that sacroiliac pain at some time in our lives.
We've got quite a few people joining us live and some lovely comments coming in after the practice as well. So you can definitely tell it's been helpful for people.
Good.
So for everyone watching, we've got a couple of minutes for some questions. If we have any questions, we did have a comment from Georgie, who is currently recovering from quite a bad flare. So she said this has been perfect timing and she found those stretches really helpful.
Yeah.
And we do, sorry.
I do know what it's like to recover from a flare. It can take a long, long time. Be gentle on yourself. Acceptance is everything, isn't it? We have to accept that we've got this condition. But also part of acceptance is saying, well, we can do something about it. We don't have to just lie down and do nothing. That's the worst thing we can do.
Absolutely.
Try some yoga for AS. Zoe and I both like it.
We do, yes, absolutely. I find it's really, really helpful for myself. We do have a question from Shabana, who asked about any stretches for between the shoulder blades. I know that's not quite on topic for tonight, but if I could pick your brains about that.
Well, yeah, I can demonstrate one for that, which we've been doing. I do understand what you're saying there, Shabana. When we were practicing there, we did a pose called the tabletop. We put the heels of the hand on the chair like that, soften the knees and stretch. Now, what you do here to get a stretch across the shoulder blades is rotate the shoulders here. And you can do that by turning the hands so that the palms face each other and take the thumbs to point to the ceiling. And then rotate the shoulders out and you get a stretch across the top of the shoulder blades. It takes a bit of practice to rotate the shoulders there, but that's one stretch that's really hard to get, but it's a really, really simple little modification to yoga for AS. And of course, whilst you're doing that, you can do the hip back as well. And so you give your whole spine a stretch. And another one is the simple back bend because what we're doing in AS is we're tending to the spine to go into a C shape. The spine naturally has an S shape, so we go in here. So a little back bend can help. So come to sitting on the front of your chair and take the hands underneath. Sit as tall as you comfortably can and just lift the front of the chest. Breathe a few times, as we did, and then repeat, taking the hands back a little. And this intensifies. And just a little back bend like that. And also, if you're getting pain, just everyday pain, this is a yoga block. It's 5 centimeters thick. My yoga chair is conveniently designed to, that's not really true, keep the block there. And it's really good if you're sat in the office or you're sat to the table at home. The top edge is just underneath the shoulder blades there. And then you can relax back against it. And even now I can feel instant pain relief from that. So just a few little tips there. There are many, many more tips on our website, yogaforas.com.
That's brilliant, thank you. And I've put a link to your website in the pinned comment on the video as well. So anyone who's watching and wants to learn a bit more, do head to the website. So that's great. I mean, we don't have any more comments at the moment, but we've got a couple of minutes. If anybody's got any burning questions, please do pop them in there. I'll also keep an eye out over the next few days for anyone watching on catch up. If you add any comments, then I'll pass those on to Geoff. Shabana said, brilliant, thank you for those stretches. So glad they're helpful.
Great, yeah. The other thing, Zoe, is that if we could attach to the playback the A-stretch guide to measuring your own BASMI, it's a really helpful thing because the BASMI is a series of measurements, 5 measurements, and they're heavily research evidenced and they're globally recognized. So we can use them to develop our yoga for AS practice, but you can also then use the results and take them when you have your review with your consultant rheumatologist or your physiotherapist and discuss the measurements that you've got there. There was a bit of concern about whether doing our own measurements was quite the right thing, but I'm reassured by consultant rheumatologists that they're happy for this to happen. So it would be a good thing to attach to the catch-up version.
Yeah, absolutely. Well, that's brilliant. So thank you so much, Geoff. We've not got any extra questions coming in, so we'll finish up there. Before we do, I'll just let everyone know that our next session is going to be next Wednesday at 1 p.m. and I'll be joined by James Allen, who is an entrepreneur in chronic pain, and he also has Axial SpA, and he'll be talking us through the Chronic Insights app that he's developed, which, handily enough, after we were just talking about BASMI, it's all about tracking your symptoms. And so that will hopefully be a really useful and interesting session for everyone. It's a relatively new app that we're looking forward to seeing everyone's feedback on. So that's great. Thank you everyone for joining us this evening and for taking part. I'm glad it's been helpful for everyone. And thank you so much, Geoff, for your time this evening. It's been fantastic, as always. And yeah, we'll see everyone next week. Take care.
Bye, everybody.